A chief political correspondent, host of Good Morning America, has been making calls. George, what have you learned? What's next?
Everyone goes back to their corners, Diane. First, for the president and the House Democrats, they have to figure out, are there any Republican votes out there? The answer to that is almost certainly no. Now, what the Democrats might do is still take some of those Republican ideas that the president talked about and include them in his bill, but then go back, especially to House Democrats, and see if they can get those 217 votes they need to pass the bill. Right now, they are short.
And what's the time frame they want to do this in?
They have to move pretty quickly. The president wants to make an announcement on how to proceed by next week, and the whole thing, House and Senate Democrats want done by mid to late March, before the president goes to Asia. If they can't get it done by then, they don't want to spend the whole rest of the year on health care. They'll put it aside.
And in some sense, today's meeting, as you know, was theater as well, George. So thumbs up, thumbs down for whom?
I think it was probably an honorable draw. You say theater was also chess. I mean, it was political chess as well. And both sides, I think, gained something. I think the president reinforced his bipartisan bona fide, showed that he was really reaching out. I think Republicans were able to show they had real substantive ideas. There are just differences about how to achieve health care reform in this country.